Afternoon, everyone. This is Andy Reese with Department on Disability Services. I see we have a relatively smaller number of people, but it could be because folks are already getting away for their holiday weekend. Just a little announcement, if people haven't received it, parades are back. And this weekend, there are two 4th of July parades for people who are just getting back out there and want one that's a little less strenuous. There's the one at Barracks Row that goes from 8th and I Southeast up to the Eastern Market Metro. And that one, people are gathering beginning at 9 and the parade is at 10. And then there is the Palisades Parade, which is a much longer parade that includes a picnic at the end. And I'll have to look that up in the course of this meeting. I don't have that time. Sunday's supposed to be a beautiful day. And Independence Day is kind of a nice time to sort of get back out and re-engage in the community. So I hope some folks are able to make one of those parades. I will be at the Barracks Row Parade, so if people are able to come to that, I'm looking forward to seeing you there. Fortunately, I will say, not much change in our data, so I'll move through it relatively quickly. So we're up to July now. In the month of June, we had no COVID diagnoses during the whole month of June. That's wonderful news. And so our total remains at 429 people that we support who have tested positive for COVID. Of these 429 people, 9 were in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 56 in natural homes, 2 in a nursing home, 4 in out-of-state placements, 37 in residential habilitation, and 206 in supported living placements. And so for the folks in intermediate care facilities, the 114 who've been diagnosed with COVID represent about 38% of people in ICFs who contracted COVID. Of those, 24 went on to die, but only 13 have been confirmed COVID deaths, representing 11.4% of people with COVID in ICFs who have confirmed COVID deaths. In natural homes, the 56 people represent about 6% of people in natural homes. And of those 56, 5 have died, which represents a little under 9%. And all 5 of those deaths were confirmed as COVID deaths. In residential habilitation, the 37 people represent about 34% of people in residential habilitation. There were 3 deaths, but 2 were confirmed as COVID deaths, representing about 5.4% of people who contracted COVID in residential habilitation placements who died then from a confirmed case of COVID. In supported living, the 206 people who contracted COVID represent about 22% of people in supported living. And of those, there were 15 confirmed COVID deaths, 21 total deaths of people in supported living. The 15 represent a little over 7% of people in supported living who had COVID and died from a COVID confirmed death. Overall, within DDA, just under 18% of the people, which is 429, were diagnosed with COVID. To date, there have been 37 confirmed COVID deaths, representing 8.6% of that 429, and 57 deaths overall. As I said, so in the 4 major placement types, we've had no COVID diagnoses in May or June. The one COVID diagnosis in May was in a host home. People who've required inpatient treatment, we have not had anyone requiring inpatient treatment for COVID since April, and there is currently no one hospitalized. As I said, of the people who've contracted COVID, 57 have died. 14 of those, the medical examiner has confirmed another cause of death other than COVID, and we are still awaiting the final confirmation of the cause of death on 6. And so what you see is we've had no COVID-related confirmed deaths since March. Amongst staff, we also had no changes in the last week. 697 provider staff who tested positive for COVID, 51 who work for more than one provider, and 10 staff who lost their lives to COVID. In terms of vaccination rates, updated this week for people supported by DDA, we're at 75%. In host homes, that's at 72%. In intermediate care facilities, 96%. Natural homes keeps going up a little bit, not as much as we'd like to see. It's at 57%. Residential habilitation is at 94%, and supported living at 83%. The provider staff is at 58%. Thank you. Someone did include the Palisades Parade is Sunday at noon at Whitehaven Parkway and MacArthur Boulevard. I won't say we received no questions. Yesterday evening, we received a letter that included 2 pages of questions. And so it's going to take us a couple of days to get through that. So we can't be providing the responses today, but we will be drafting a written response to questions that were submitted to us from a group of folks yesterday, including Quality Trust, the DC Coalition of Disability Service Providers, the DD Council, Disability Rights DC at University Legal Services, the Georgetown University Center for Excellence in Developmental Disabilities, and Bob Williams. And so this letter was sent to both Deputy Mayor Turnage and me, and we'll be drafting a response and working with DHCF to make sure that we're responding to all the questions. And I expect we'll have that completed in the next week. Just so people are aware, after this week, for the next 6 to 8 weeks, Winslow Woodland will be facilitating this discussion. I'm going to have to be out of the office for a period of time. And I'll be returning, I'll see, end of August would be my hope. And I can say, I think it has been published. We got the copy that the council has voted on a final budget, and the DDS budget remained generally as proposed by the mayor. except that there was a reduction to our services to clients within DDA, a reduction of $40,000. There wasn't a specific explanation for that amount, um, just indicating that council felt that we could um, take such a reduction based on um, the possibility, I guess, of getting more enhanced federal match in the first quarter, um, given that we have had some additional funds available in the waiver in the last in fiscal year 20 and 21. In the overall scheme of things, the waiver, which is $92 million, 40,000 is not such a significant hit. And it's that same line, so it would include, for it's DDA, so it includes waiver and residential, but which is the largest part of our local budget, as people know. Can we provide an update on where things stand with CMS and the retainer payment? So in order to have the authority to make the next round of retainer payments, we need to amend our Appendix K. And in order to amend our Appendix K, we need an approved amended Appendix K, which has now been with CMS for going on 90 days, I think. We actually have a meeting with CMS this afternoon. We hope to resolve all their lingering questions about the amendment that's before them. And as soon as that's approved, we will then submit another amended Appendix K for approval. And as soon as that is approved by CMS, then people will be able to submit claims for retainer payments. At this time, the only authority we have was for the original 90 days of retainer payments. So the additional 90 days of retainer payments require this revised or amended Appendix K, a process which for some reason seems to be taking quite a long time. Hmm. Good question. So is the biweekly COVID staff training still a requirement? And I know that Kirk is not here. I'm hoping we have someone who we can move to be a panelist from Quality Resources who could tell us whether that is something. Ah, Kirk is here. Therefore, Kirk um, can respond to that question. So the biweekly training is no longer required. Can you tell us what DDA is doing to encourage people in natural homes to be vaccinated? So for folks who are in natural homes who haven't been vaccinated, they're being, and Winslow can correct or add to this, they are being followed by our nurse consultants, and they are having monthly contact, I believe, with those people to revisit with them their earlier decision not to get vaccinated, to answer any ongoing questions, to see if their position has changed, and to encourage the whole household to get vaccinated. But if Winslow wants to supplement that answer, please feel free.
You're absolutely right, Director Reese. The nurses are reaching out to people who have been reported as refusing the vaccine for various reasons and providing training on why, you know, they should reconsider that. And to date, we've seen some movement with the follow-up. So we have some people who've been called at least 3 times. I was reviewing that documentation yesterday, and you know, some people are still hesitant, but we remain hopeful that we can help them with their decision.
As a follow-up to that, and I'll get back to the questions in the middle, but have we considered using peers or family members to talk to family members who are hesitant to get vaccinated?
That is been considered. Operationalizing it is a bit tricky, however, because we usually don't have all the contact information for specific family members or people that we serve family members who may have been vaccinated. But we do know from research that credible messengers or people who are trusted by the person are good resources. We have considered that and looked to operationalize it, but it's not as easy as we thought.
And then there's a request whether there are any providers, and if you could type this in to let us know, and then we can move you to be a panelist. If there are any providers who have implemented some kind of incentive or other program for encouraging their staff to get vaccinated that has been effective, and could report on that in the same way that RCM did, I think that was 2 weeks ago. So if any providers have had a successful strategy that they'd be willing to share with the group, if you could just type that in, and then Charlisa can make you a panelist. So the letter that was sent, which was regarding our ARPA plan, the American Rescue Plan Act plan, which makes additional funds available. Can we provide any update on the contents of the plan at the forum today? I mean, I don't know that it's really changed from the overview that we gave 2 weeks ago. And we are still working along with DHCF to sort of look at the comments that we've gotten on what we've done so far and finalize a draft. We've provided them with narrative of what each of the initiatives looks like, which is essentially the bullets that we provided in our meeting 2 weeks ago. But I'm not really aware that it's changed all that much from 2 weeks ago. So as the draft plan becomes more final, we will make that public. So Margil Holmes has shared that they're offering a $100 bonus to staff who get vaccinated. Can you share whether that's been successful? Because the proposal we have in our ARPA plan so far, first of all, there's some question about whether there's going to be a district-wide plan for staff. And so we'd want to align the kinds of initiatives that are done across the district. It's not that specific to allow us the flexibility to provide support to to agencies to do what's effective in their agency. So to the extent people have specific suggestions, like if that $100, I know that when Danielle from RCM shared, they had started with a $50 incentive that seemed not to be that didn't quite hit the mark, and they came up with some other incentives later that seemed to be more effective. So it sounds like so far that hasn't been successful at Marshall Homes. So a question whether Winslow, there are materials that would be helpful, and I don't know if Chioma or Titi are here, that would be helpful for the nurse consultants to have with them when meeting with folks to provide education. I mean, I think all of our nurses, that's part of their job is to do education. So I'm hoping that they have what they need. And anyway, I don't know what specific materials they're sharing.
So to date, the majority of those contacts have been virtual, and I am not aware of actual pamphlets or handouts that have been given. I know from reading documentation that the nurses have input, they are very versed in terms of their understanding of mitigation strategies as well as effectiveness of the vaccine overall, and have cited what the general public's response to vaccinations has been, as well as the rates of infection and untoward outcomes for those who have not been vaccinated. So I've read a few of the notes that have been entered in this discussion with between the nurses and people who live in natural homes, and I can't say that they've been providing handouts or other materials. I know we have multiple websites that we have used in terms of sharing with providers, but I'm not certain as to whether we've shared that with natural homes.
We also have videos, but I don't know that we've used those in the education. We've used those with some of our, in some of the work that's been done with self-advocates. I don't know if the nurse consultants use it when they speak with families of people who live at home. Someone has questions about the Appendix K. Who would they speak to regarding this? I think they could email, the best would be to, at this point, I would say email Crystal Thomas, and she can direct your inquiry.
Yeah, thanks, Robin. If you would send me those materials, I would definitely share it with our team so that they can have it at their disposal.
I don't see additional questions. Unfortunately, like I say, we got 2 pages of questions, but it was yesterday evening, and so walking through all of those right now, I think it would be a more effective. It would be more effective for us to prepare the written responses, and then we can share those with people. We'll respond in writing, and then we can share that response with everyone next week, so that everyone has the benefit of hearing the questions and the responses. And as people may be aware, our ARPA plan is due to CMS by July 12th. So we will be working on finalizing it over the next week. And as I said, as we have more details, we will share them. The issue in part is you're undertaking new initiatives. So, there may not be the level of detail that people want to see at this time, because we have to get CMS approval for the initiative um, before we launch it. And so, it may not be at the point of having the level of detail that some of the questions seem to be asking for. They're good questions for us to think about if the proposal is approved by CMS as part of the plan. And then as we develop all the specifics, we can make sure that we address those specific questions that people have raised. So if there aren't additional questions, we can end early. People can, although it's kind of dreary to get started with your long weekend. However, it seems that the rain and the cloudiness will get out of the way today, and that we're going to have a beautiful holiday weekend. As I said, I hope I get to see some of you this weekend. I'll be at the Barracks Row Parade. Kicks off at 10 a.m. People can start arriving at 9 a.m. to 8th and I Street Southeast. Palisades Parade, bit longer, but always nice as well. And I will not be seeing all of you until about late August, perhaps early September. So I hope everyone has an enjoyable weekend. And as I said, we'll be responding to the letter, and then we can share the questions and answers at the call next week. Thank you.